If you are preparing for a VBAC, I have put together a free guide to help you in your preparation. It's called Preparing for a VBAC, your first three steps to an empowered birth experience. This guide will walk you through the first three steps that you need to make on your VBAC preparation journey, and it'll make the whole process a lot easier and more straightforward for you. So if you want to grab that guide, go to thehannahgill.com/first steps. Again, that is thehannahgill.com/first steps. Hey everyone, today we're going to be talking about pelvic floor physical therapy and how that relates to VBAC and C-section and postpartum recovery. Our guest today is Dr. Jessica London. Her mission is to meet mothers where they are to raise the standard of pelvic health education and postpartum recovery rehab. She's a mother of two. She had a C-section and a home birth after C-section. She's a doctor of physical therapy, a pelvic floor therapist, a pre- and postnatal coach, and the founder of Your Postpartum PT and Wellness. Your Postpartum PT is a 100% online pelvic health coaching company that serves women in pregnancy and postpartum to reduce leakage, pain with intimacy, prolapse, and other childbearing or birth-related injuries. I'm your host, Hannah Gill, and this is Motherhood Flow. Hi, Jessica. Welcome to the show. Thank you so much for being here.
Yeah, thank you so much for having me, Hannah. I'm so excited.
So if you could just give a brief introduction about you, what you do, and how you got started doing that.
Yeah, so I'm Jessica London. I'm actually a doctor of physical therapy. I started in orthopedics and then pivoted to specialize in pelvic health, pregnancy, postpartum, and beyond for strength training, specifically working with pregnant and postpartum mothers now. But I also have two little kiddos myself. I had a C-section with my first kiddo and a VBAC at home with my second. And I reside here in Arizona, so sunny Arizona in the Phoenix area. If you're listen to this and it's the winter right now, I am just soaking up all the vitamin D for everyone.
Well, awesome. I do want to get into your birth stories first because that's originally why we had connected to talk about your C-section and then your HBAC. But then I want to dive in deeper to pelvic floor PT, what all that entails, and kind of how that works with both C-section and VBAC preparation. So if you want to get started with your birth stories first, you can go share as much as you want, go into as much detail as you'd like. So.
Yeah, absolutely. So in 2019, I had my first kiddo. I actually was planning a home birth for him as well in 2019. But I was, 42 plus 4 when I actually ended up having him. And 3 of those days I was in labor at home before I made a very safe transfer to the hospital. So I think sometimes people hear like, oh, you tried a home birth and then you ended up in the hospital. It's like, it was a very safe transfer. We were very monitored and ahead of it. But when I did get to the hospital, because I was so fatigued and tired and having a ton of back labor due to his positioning, I did accept like an epidural, and then all of the interventions started following quickly after that, which kind of landed me still at the hospital for a very long time. I was there for over 24 hours, still laboring, until I got to the position of, finally being dilated, pushing for 2.5 hours, and then calling a C-section, just really due to his position being really tough and not descending down. So we ended up calling a C-section at that time. So of course I was like, so devastated and so confused because my first pregnancy, I was so healthy. Like I, met all of the markers. I was a very safe home birth candidate. I was exercising all the way up until his birth. But really, really looking back on it now, since that was so long ago, there was so much of like the energetics piece of that, or the mental, emotional prep for the home birth, that I really didn't do justice. Kind of looking back, went into my preparation, a lot of what I did was really physical, and I educated myself, right? But anyways, long story short, I ended up having that C-section in 2019. That's actually when I really pivoted my career from orthopedics to pelvic health, because I realized at that time, after being in the hospital, really waiting for a physical therapist, occupational therapist, or someone in the rehab world to come visit my room to give me guidelines to get in and out of bed safely, to get to the toilet safely, to, discharge me for safe environments, and, how to navigate my home environment after having a major abdominal surgery. that's when I realized like no one ever came. And I was like quite pissed off. So I turned like my rage from my, confusion of having a planned home birth into a C-section. And then that rolled right into like, what the heck? Why are women totally just left to figure out the rehab on their own, even after having a major abdominal surgery? And so that really fueled the mission for me to start Your Postpartum PT and Wellness and to pivot. But kind of in that interim, as I was learning and gaining more insights and education and birth prep and pregnancy and postpartum, I got pregnant again, and I still very much believed in, the physiological ability of a woman's body to birth. And I was still really wanted to see if a home birth was possible for me. So in 2022, I ended up finding a really amazing home birth team here in Arizona that was willing to take me on, totally supported me, even despite my previous C-section. And I ended up having a really redeeming and obviously successful home birth at home. But I prepared much differently for that birth than I did for my previous home birth experience. And I really think that is also what allowed me to find that surrender and the release of the control and just really let go of any expectations or outcomes that I, put preconceived on the quote unquote plan.
I was going to ask if you were in like the pelvic floor PT world before your first birth, because that does usually make a huge difference in how you end up preparing physically, especially. But as far as the mental prep, a lot of first time moms, I feel like, aren't open to home birth. Usually it's like after their first birth. So what like made you choose home birth to begin with as a first time mom versus birthing at the hospital?
Yeah, I really, being in healthcare myself, I think you kind of really see the behind the scenes of healthcare. And I think that's why a lot of people in healthcare end up choosing out of hospital births as well. It is very common for that to happen. But I really didn't appreciate the way that the standard of care and the traditional healthcare system and the traditional hospital system believed in birth, right? I guess I really believed that women should be, birthing in dark rooms and that it's so physiologically normal and really just honoring and that deep inner wisdom and intuition that women hold and mothers hold, to create life. Like we should be able to have that same due diligence and same honor in how we birth life. And I just really didn't connect with the hospital based system. And I actually did start in the hospital. I transferred when I was late in the 20 weeks. So I think it was like 28, 29 weeks pregnant when I left the hospital based care and ended up finding a home birth midwife that would take me on that late. I was almost in the weeks of the early 30s. And it was kind of going through the motions of those 10-minute visits or those 20-minute visits. You're just in, you're out. They punch the clock. They, give you a handout, a PDF book, and they're like, best of luck. And I think because it was my first birth, I was like, really? Like, this is how we're preparing mothers for their first child? Like, that's how the hospital system or that's how the traditional healthcare system is actually preparing mothers. And I just intuitively did not feel like it was the experience that I wanted, the support, the care level, the individuality of all of it. And so that's when I pivoted, kind of later in my pregnancy to find a home birth midwife.
And what did you do? Because you said like the first time around, you didn't really do much to prepare mentally, and preparing mentally for a VBAC in general is a lot harder than, not harder, I won't say, but it has a lot more to it than preparing just for a first time vaginal birth. So what did you do differently just to prepare for a VBAC, but also having a VBAC at home, so an HBAC?
Yeah, absolutely. So for my first pregnancy, I did like the normal, like, oh, you know, walk and mobilize and all of those things from a physical aspect, but I really did not tap into like how I would feel in my body and the visualization practice and the deep calm that I would need to feel when I was in a really uncomfortable situation. I just figured like, yeah, this is probably going to be super painful and it'll be the hardest thing I do in my life and I'll just get through it. And that was like my mindset going into having an unmedicated home birth, but it was so far from that. And what I did differently in my second, pregnancy to prepare for HBAC at home, it was physical and mental, right? Like now I have all of the tools and resources that I didn't have on board because I didn't specialize in pregnancy, birth prep, postpartum. So obviously I did my, pelvic floor and core prep very different in pregnancy than I did with my first. I also utilized like chiropractic care in my second pregnancy, and I did not utilize chiropractic care in my first pregnancy, mostly just because a lot of what I felt was going on was like baby's positioning. And so I really focused on trying to make sure that, baby could be in the best position as possible. But even above all of that, I think you can eat the dates, drink the tea, go to chiro, do pelvic floor PT. But like if you're not actually working on the mental and emotional prep when it comes to preparing for an unmedicated or even a VBAC or HBAC, then you're missing a huge piece to the puzzle. So what I did differently in my second birth was I really allowed everyday living to be my exercise of like, if I was triggered, if I was uncomfortable, I would literally like reframe and let go of attachment, let go of surrender into that moment. But then I also did like physical things too, of like putting myself in uncomfortable situations of like the ice cube test and, really visualizing what a birth would look like. I imagined, my midwives saying, reach down, that your baby is coming. And I imagined, even to the extent of, I knew I was having a girl for my second birth. And I even imagined to the extent of me having this successful home birth would allow me to have a different perspective for my daughter one day when she has a baby. And maybe one day I'll be at her home birth. Like I really future visioned and manifested and forecasted, if you will, into what that would be like. But I also like at the same time, like had to fully surrender to the idea of not being attached to the outcome if it did go a different way. And I was okay with that.
I love that you bring all that up because this is literally what I talk about with my students and clients all the time, because I tell people like you can do all the physical things. Like I prepared physically for my VBAC too, but the mental preparation was so much more important for me. I like that you brought up the ice cube thing because I wanted to go unmedicated my first birth, and then I did nothing to actually prepare for that. I just took like a basic class and thought, oh, I'm just going to do this. And for my VBAC, I got into a freezing cold shower to practice breathing and like tension relaxation, which was like phenomenal, like great way to help prepare for an unmedicated birth. So it's like taking that ice thing to a next level. But I also like that you mentioned like surrendering to not being attached to the outcome, because I hear so many women say like they have tried for a VBAC and it might end up in a repeat C-section, and then again they feel like they failed. But that mental preparation ahead of time can really help if things have to pivot, and changing your mindset and your beliefs around that to it's not about the outcome, it's about the journey and the growth along the way. So I think that's really, really important to remember no matter what type of birth you're preparing for, but not being attached to the outcome and just really focusing on what you can control and releasing what you can't control.
Right. And such is life, right? Like I feel like these principles, it's like really personal development in anything, right? It's really detaching from all of these things and leaning to the trust and leaning into the surrender and leaning into your intuitive calling. It's like as simple as even if like you stub your toe on the couch, like while I was pregnant, I would be like, how am I going to regulate my nervous system in this moment? How am I going to tap into the surrender? How am I going to tap into breathing? How am I going to tap into, pain modulation and really understanding like I am in control of how I respond to this situation. And so much of that was preparing for my birth, but like so much of it has also prepared me for like life and parenting and all of the things that come after actually delivering the baby.
Yep, I would 100% agree. It's not just limited to this one time frame. It's a life skill in general. Um, so one thing that I really changed for my physical prep was I went to a pelvic floor therapist after my C-section and during my VBAC pregnancy. So I really want to kind of dive into that because after going through that process, I recommend it to anyone and everyone. I don't care what type of birth you've had. If you haven't even given birth, if you're having issues. So what do you think are the primary benefits, or like what do you see for your own preparation with your clients for pelvic floor PT, not just for VBAC preparation, but for C-section preparation and recovery as well, kind of both those births and what the scenarios look like?
Yeah, I mean, all births and preps, if you will, deserve prehab and rehab, in my opinion. So you kind of nailed it. Like, it should just be standard of care. Unfortunately, it's not. It's something that we just really have to advocate for and use our voice and share our desires with our providers, but also with our spouses and partners if we decide to go outside that health insurance model, which is where a lot of good care is. But you're right. It's like, it really does start in pregnancy to prepare your mind and your body. But first and foremost, it's about finding connection to your pelvic floor and your core system. And in my belief, that starts in pregnancy. But if you're listening to this and you're postpartum, it's never too late. The first step really is what we call mind body connection in our program. It's really allowing your body, your nervous system, your brain mapping, if you will, to truly connect spatially, somatically, to your pelvic floor, so that not only do you know how to contract and keep it strong and work that muscle, but you also really know how to tap in a flip of a switch to release and to lengthen and to let go. And that's actually what more pregnant and postpartum moms need, especially if they've had a prior C-section, because there's been so much tension that possibly has been built up, especially with scar tissue tension. And the body itself really went through a traumatic event, right? So major abdominal surgery and having a C-section is huge, and it is a huge traumatic event. And so if we really don't take care of our body afterwards and getting the mobility back in the pelvis and the hips and the low back, and really freeing up a lot of those tissue restrictions and that scar that might be stuck down there, it will impact future births. And so when I was preparing also for my HBAC, I also went back to the drawing board and did a ton of restriction release stuff, a lot of deep hip mobility stuff, a lot of pelvic floor release and lengthening work, and even went back into like my upper, middle, and lower abdomen and did a lot of like fascial release stuff too, especially as baby was growing, and making sure that there wasn't any mobility or tissue restrictions that was going to impede baby's position in the second pregnancy.
So I just, before like my C-section, like before my first pregnancy and birth, I had never heard of a pelvic floor PT. The extent of that was do Kegels. That's like all I knew. And everyone just assumes like Kegels are the answer. But after my C-section, I like that you brought up like how much tension there is, because after my C-section, like my pelvic floor was extremely tight and I was doing Kegels and I didn't know it was too tight. So I was making it worse. And everyone just assumes like, oh, I'm just going to do Kegels and I'll be fine. But I think it's really important to like note that it's really focusing on that lengthening and that release, like you said, especially for birth, because if there's so much tension there, then baby's not going to be able to like go through the birth canal. So as far as like positioning, because a lot of people who are preparing for a VBAC are so concerned about baby's position, especially if their C-section was due to breech or being posterior, asynclitic. My son was asynclitic with my first. So how can it really help with the positioning of baby?
Yeah, I mean, it's not just the pelvic floor even. It really is like hip mobility, mid-pelvic mobility, upper pelvic mobility, right? Lumbar spine mobility, thoracic spine mobility. It really starts like your shoulders all the way down to your pelvis. We need to have good range of motion and good mobility throughout all of those structures, because if your thoracic spine is tight and tense and doesn't have the full range of motion, then your rib cage won't. And as we know, as baby grows, the rib cage plays a huge factor in how that coordinates with the pelvis, and that reaction it has with inverse relationship it has with the pelvis and the pelvic floor too. So that mobility is going to be really important to target all throughout. And in regards to baby's positioning, it can impede that, right? So if we are having those mobility restrictions, we're not allowing baby the freedom and the movement and the ability to kind of nestle in and get into that good position that we need to, especially if there's like one-sided tightness, kind of like that asynclitic positioning that you're talking about. So if our hips, our glutes, our pelvic floor is really tight and tense on one side of the pelvic floor, whether it's just due to how you live life, or maybe you had a previous injury that was never really fully resolved, which in my case, I did have a previous injury. And I think that also contributed to the asynclitic and posterior position as well. But, tailbone mobility and function too plays a huge factor in how baby descends and how baby gets into a good position. So there really are so many components to the body that we are really looking at when we're thinking about trying to get baby in the best and most optimal position, not just the pelvic floor needing to release and lengthen, but how it all works together holistically.
And how does like the C-section scar and the tissues there play into everything? Because I recommend to everyone, no matter if you had a C-section last year or 20 years ago, to do scar work. So how does that play into everything? And what are like the benefits of focusing on scar work and releasing that?
Yeah, so I think we forget because we're not really educated on what a C section is, but it is 7 layers of tissue that are cut or separated together. And so, as these layers are cut or separated together after a C section, if there is no address to the tissue layers, these layers can kind of get stuck and tight together and kind of bound down together. And of course, the body is responsible for healing. So, it's laying down as much tissue as neural networks and everything as possible it can to just heal the body. And it doesn't mean that it's always being done in the most organized fashion. It's just emergency. We need to heal the body. Let's throw all of the work that we have at it to create new tissue and to create new connections to be able to seal up this traumatic event that we just had. And so it really does take our work to be able to kind of make sure those tissues and those layers are not adhering to each other or getting stuck together. And there's a lot of different modalities. You can do a lot of things at home just with your hands. You can also use tool instrument massages as well. You can use cupping, dry needling. There's a lot of different ways that you can address a lot of that scar tissue and tension. But what does help it is starting early. So a lot of times people think like, oh, I just had major abdominal surgery. I'm just going to wait until my 6-week checkup, or I'll just wait until 12 weeks or whatever it might be. And there are things that we can do, even like the first 2 weeks post C-section, above or around the scar, not on the incision site, even just bringing sensation and waking up that nervous system a little bit from what just happened. So there is a lot of research to show too that early intervention actually really does help from these tissues and these layers kind of getting really stuck and bound down together, where, if you wait 6 months and then you're working on it, you're like really having to, push a big boulder uphill because you're kind of having to do all that back work versus just, working in that acute rehab stage, which every other scar would do, for the record, like hip surgeries, shoulder surgeries, knee surgeries. I worked in orthopedics for years and in oncology in the hospital for a while as well. And so when there is a scar, there needs to be scar management and scar work on it and around it to be able to prevent a lot of issues to pop up later. It's just, again, like somehow women were forgotten in C-section scars. So we still want to take the same musculoskeletal rehab principles and tissue healing principles that we would to any other orthopedic injuries, just like we do with the scar with a C-section.
I hear people say all the time that they 10 years after their C-section, they still can't feel. They have numbness in the area. And like the whole section of their stomach is numb, which is like what you spoke to about waking up the nerves in that area. And I think it's just so important. And like I said, like you said, it's a thing that's forgotten. And hopefully with the way social media is, people are just becoming more aware of it. But one of the big hangups I see a lot is people say because of the expense, because it's not like they want to go to an out of network provider that doesn't take insurance, so you can get the best care, but then it is really expensive. So what do you feel are ways to like help mitigate that or help accommodate more clients that are wanting to get this work done, but may have a financial barrier?
Yeah, absolutely. I mean, well, thank God to the internet, right? There really are so many resources. If we're looking at YouTube or TikTok or Instagram, like there are a ton of resources out there. There are a lot of like low cost apps or courses and programs if you are really in that financial barrier position and not willing or able to invest. But I think this is kind of like a bigger question, right? Is people will drop thousands and thousands of dollars on baby gear and doulas and a midwife for home birth. But then when it comes to postpartum, we just totally forget to budget for it. We forget to ask for finances for our registry. And or also we just don't have the same perceived value that we would for our own personal postpartum rehab care than we would for like doulas or midwives or, the $1,000, nursery crib that we don't really need, right? So people are spending money around pregnancy, and baby, but really we need to kind of reframe how we view spending money and the perceived value on the support that moms actually need. So I think that's actually like the bigger issue and the bigger question at hand that you're probably working towards as well. But I do think that, yeah, so it's a reframe. It's also allowing mothers to advocate for themselves, to ask for finances for their registry for postpartum care and support, and allow people to support you in that if you know finances are tight, or just really make sure that you're budgeting for it just like you're budgeting for pregnancy and maternity care. Like it is one more thing to budget for 100%, but it is of equal value as everything else that you're spending money on and budgeting. And in addition to that too, like there are so many resources that you can do a lot of these things independently online. And then it just goes to like, how quickly do you want to get better? Like how much of a priority is this for you to have one-on-one support and customization and personalization to your specific plan versus following something for free online? Because following something for free online will get you some progress. It will get you some education. And it might get 10, 20, 30% progress. But what we find is a lot of clients that try to do things independently on their own or try to buy more cheaper, like, those apps, if you will, is they're not actually getting fully better because there is not that personalization and one-on-one support.
I would definitely agree with that because I went to like an in-person PT because I was just having like major internal problems that I needed to have addressed. But I think the personalization is so important because, like I said, when someone just told me just do Kegels, like that's not helpful. Or what's working for someone else's body isn't going to work for this person's body because we're all having different issues and concerns and problems. So we can't just say like, oh, well, what did you do for your pelvic floor PT? Because that's not going to relate to what is going on with you. So I think that's very, very important to note that customization and individual attention is the big differentiator there. So from like your experience with your clients and relating to your own personal experiences with your births, like what are you seeing with a lot of your clients with C-section and VBAC? Like what are the primary issues you're seeing or concerns you're seeing that you guys address with your programs?
Yeah, absolutely. So we tend to see it's all over the map, right? Everyone's body, like we just talked about, everyone's bodies are so different. Everyone's symptoms are very different as well. But, kind of consistently, what we're seeing is those that have had C-section actually report higher incidence of pain with intimacy, pelvic pain, hip pain, pain with, tailbone pain. We're actually seeing that. And that makes sense, right? Because you had major abdominal surgery with no mobility, no tissue restriction reliefs or anything like that. And so all of that tension just remains. And so if that tension remains after that C-section, then it will kind of roll into all other areas of their life. And so that tension can cause a lot of different things, like we just talked about: pain with intimacy, leakage, hip pain, tailbone pain, back pain, even, really getting into some of more prolapse concerns as well, even if they maybe don't have like a severe prolapse, but that tension essentially like supercharges the symptoms that someone might be feeling with prolapse versus like the pelvic organs actually descending further. If you have so much tension, it's just like really irritated and annoyed. And so the symptom reproduction is that much higher. That's what we're seeing consistently with C-section. So, the idea of like, oh, your pelvic floor is spared if you have a C-section, like I won't pee my pants or I won't have prolapse, like that is not true at all whatsoever. We work with a ton of clients who still have leakage and still have pelvic heaviness, even though that they had a C-section. We will say though, with VBACs or with vaginal burrs, the reports are higher for stress incontinence and the prolapse symptoms as well, especially if you did have more severe tearing, any tool assistance, episiotomy, forceps delivery, vacuum assistance delivery, second, third, fourth degree tears. We're seeing a higher incidence or long pushing times, right? If you pushed for 2, 3, 4 hours, we're seeing prolapse be more consistent with those type of birth methods as well. But again, it doesn't mean that you're not going to have pain with intimacy, because we definitely have people that have had vaginal births and still are struggling with pain with intimacy as well. But we do see like it weighted a little bit more on each of those different types of births.
So the moral of the story is no matter the type of birth, you can have pelvic floor problems.
Yeah, but this is also like why, it's so great to get free advice is free advice, and cheap advice is cheap advice, right? Like at the end of the day, because if it's like, oh, the best C-section rehab protocol, it's like, well, what else is going on there? Like that is really, really great for somebody who is not experiencing any pelvic floor related issues. So I would say like the best rule of thumb is like if you feel like you had a great birth experience, you're just kind of feeling weak and you generally want to recover and you want to rehab, then doing something like that would be super helpful for you, because we definitely want to focus on rebuilding the foundation. But if you are really exhibiting more signs and symptoms of pelvic floor dysfunction, leakage, pelvic pain, pain with intimacy, prolapse, deep hip pain, that's kind of unexplained, urgency where you feel like you have to go to the bathroom and you have to go right now because you cannot wait. These are more signs and symptoms that you really do need more personalized one-on-one support, because it's going to be very different from a root cause level of why you're experiencing those things. So two people who are experiencing leakage, it could be very different reasons why they're experiencing those leakage, which is where we want to address.
So if someone is having, like, say they are, I know you focus a lot on postpartum, but say they're postpartum, but they're also preparing for a future pregnancy or birth, specifically for C-section. So if they know they're going to be having a C-section, what can they do to like help that recovery process during their pregnancy? Can they do things to prepare for that, or is it usually just like after the C-section you can do stuff?
Yeah, we would have them prepare the same as any birth, right? So just because you're planning for a C-section doesn't mean that you shouldn't do all of the other core engagement and pelvic floor reconnection and connection strategies. So we typically will have people prepare the same. But what's the biggest difference is we're really preparing people for early acute rehab. So we're making sure that they have all of the equipment on hand that they'll need, the specific belly bands, maybe a specific pillow. We're making sure that ergonomically, not only in the hospital, but also at home, how is their room set up? How is feeding going to be with having a C-section? How should they get in and out of a bed? So we're really trying to pre-educate them on, hey, if you have a planned C-section and you know you're going to have this C-section, how do we prepare you as much as possible for not only how is a C-section going to go down, what are your choices, what are your options for this C-section, but then also what does early postpartum recovery look like, and what do you really need to focus on the first 2 weeks, the first 2 to 6 weeks? That is going to be very different than if you are recovering from a vaginal birth, because it is very different, right? With C-section, the rehab protocols are very different for those first 6 weeks than it is for somebody who has a vaginal birth. We would recommend different things for different people.
So I want to bring that up because as someone, like, we have both experienced a C-section and also a vaginal birth. And after my VBAC, I just wanted to like get up and just like move. I was like, I feel good. I didn't have a surgery. Like, let me get up and just do all the things. Obviously, that's not recommended. So what would you tell someone who is like, yes, you feel great after your vaginal birth, you didn't have any complications, but you still need to take it easy. You still need to focus on that core work. So what would you tell someone who's like trying to get up and do all the things if they should not do that?
Yeah, yeah, and it's always fun talking to people who have had two different birth experience, because I was like, oh, girl, those were so different, right? Like it was a night and day difference
Yeah.
in birth recovery for sure. So I'll kind of break it down for C-section and then vaginal birth as well. So if you've had a C-section or you're planning to have a C-section, really those first 2 weeks post C-section are really focused on post-operative, like reducing as many post-operative complications as possible. And so typically this is making sure that you're up and walking, you are moving a little bit more because we're trying to get blood flow circulation. We're trying to get those calf muscles and the pelvic floor to be that sump pump for you to really circulate the blood so we can reduce risk of blood clots. We're also just trying to stimulate the lymphatic system and the circulatory system, and just really making sure that we're protecting the incision site as much as possible those first 2 weeks as it's in its most vulnerable state. So this is also going to look like a lot of bed mobility, protecting the incision, making sure that you're getting in and out of bed safely, that your room is set up appropriately, you have good ergonomics with feeding and changing and all of those things because you did have major surgery. Now flip over to a vaginal birth. Those first 2 weeks, we are like, you should not be walking. Like, you need to be in your bed majority of the time. Occasionally, yeah, like you're up, you're walking to the bathroom. Okay, maybe you're up and filling up, a water, or someone else should be doing that for you. But anyways, maybe you're like up and walking briefly, like 5 minutes in and around your room. But really, those first 2 weeks for a vaginal birth, we want to reduce as much gravity on the pelvic floor as possible. So, if you can imagine you're standing up, your pelvic floor is at the bottom of your pelvis. When you're standing, you're in a gravity induced position at the pelvic floor, which just pulls the pelvic floor down even further. And you just had a baby vaginally. So we're really actually trying to protect the pelvic floor as much as possible to not allow gravity to pull down those first 2 weeks. So this does look like being in and around your bed as much as possible, being more in a horizontal position to try to take as much pressure off of the pelvic floor as it's healing and as it's stretching, and as you're potentially, did need stitches or whatever it might be. And then we're gradually progressing your walking, gradually progressing your bed mobility, your reconnection exercises, and what we call gravity eliminated, and then moving towards gravity positions, right? So this is on your back, on your side, maybe on your hands and knees, then maybe in a half kneeling position. Then we're getting you all the way up to standing, and then we're trying different planes of movement. So that's similar for like a vaginal birth progression. C-section, you're going to be walking a lot more those first, 2 weeks. And then from 2 to 6 weeks for C-section, we're really also thinking about desensitization around the scar to address that numbness and sensitivity changes that you talked about. And also making sure that we're starting some light and gentle mobility above or below the scar, and making sure that the hips are staying mobile, the low back, the pelvis, the tailbone is also staying mobile, so we can get ahead of any tension that might be created.
And I think because so much goes into this, especially postpartum, I'm glad there's more of an awareness about this so people can prepare ahead of time that they're going to have to be doing these things postpartum, because when you're in the middle of postpartum with a newborn baby, you're not thinking, oh, I should probably be doing this. So preparing ahead of time and having that on your radar is so beneficial. So what would you say, like as far as like your guys' programs, and how does all that look? Like if someone wanted to work with you, like I know you guys are all focused online. So how does that work for this type of thing?
Yeah, so we actually focus, 100% working with clients online, but it's very highly customized one-on-one. So it's not just another course to go through or app to, pay for that you never use. The way that we work with clients is in anywhere from a 3 to 12 month span. So we literally are building relationships with clients depending on where they're at in their pregnancy, where they're at in their postpartum, but also what are their goals, right? Are they coming to us in pregnancy after a C-section wanting to attempt a VBAC birth, and we're helping them prepare and do VBAC prep? And then we're also there for them in postpartum, because recovering from a VBAC is very different than a C-section. So oftentimes if we get clients in pregnancy, we're working with them for at least 6 months, and that's in pregnancy and in postpartum to make sure that the whole spectrum is being cared for. That's honestly how I believe all moms should have support. It just really depends on if that's what you desire for yourself and your body, right? But we also, work with clients just in postpartum too. Maybe they're, recovering from a very unexpected C-section or recovering from a VBAC, and they're like, whoa, I was not prepared for this. My C-section was very different. How do I recover from a VBAC? And so then we focus also on early acute rehab, and then VBAC recovery, and then also kind of covering that gap between rehab and strength training. So what we do differently as well, working with clients one-on-one, is what we also are finding is not only is there an early postpartum gap in the healthcare system, but also a lot of clients that we end up working with do go in person to pelvic floor PT or have maybe 1 or 2 sessions with a pelvic floor PT in person, but then they get discharged too early and then they try to get back to weight training or running or CrossFit. And that didn't really translate because a lot of the exercises they were doing were more quote unquote rehab based. So really where we also feel like we fill a gap and a need is being that hybrid approach between not only understanding and doing rehab as pelvic floor therapists, but also we all specialize and are all certified in being pre and postnatal strength training and nutrition, right? So we're really kind of holistically supporting moms with, prehab and pregnancy, rehab and postpartum, strength training and nutrition and beyond as you kind of get longer into those postpartum phases and have different goals and desires and everything like that. So that's really what we do. 100% online, mostly because moms are busy. And we worked with clients, and I started off as a mobile pelvic floor physical therapist where I would go to moms' homes. But what I was finding during that process is that, their kids got sick, they would cancel the appointment. They would get sick, they would cancel the appointment. They forgot about something, then they would cancel an appointment. Or they just were like overwhelmed with someone coming to their home or having to leave their home because they also rented a space for quite a bit too and had moms come to me. And it's just like the overwhelming amount of details and mental load that mothers already carry, adding going to and from appointments and scheduling childcare and, trying to go for yourself multiple times a week, that's a lot for you to put on top of your schedule. So really the reason that we hyperfixated and specialize in 100% virtual care is because our mission is to meet moms where they're at. And what that means is that there's no disruption to their care and their healing, and they can still prioritize themselves. They can still prioritize their care and their recovery and their healing, despite being in the trenches and despite being in the thick of it in those first few years postpartum as well.
Yeah, I love that you brought that up. One of my friends literally said she had all these problems, and I said, you need to go see a pelvic floor PT. And I kept following up with her. I was like, did you go see that PT yet? No, it's just too far. I don't feel like getting out of the house and driving. And this would have been perfect for her to have that option just to do it on her schedule and her time and not have to inconvenience herself with that.
Yeah. And a lot of times too, like really good quality pelvic floor PTs are further away, especially if you're living in a rural area. We work with a lot of clients too that the closest pelvic floor PT is like 30 to 45 minutes away. And, if you have 1, 2, 3 kids or maybe you're working, like we don't have 2 hours out of our day to just drop everything to go for a 30 to 60 minute PT session. So the hybrid approach or the virtual approach that we're really working through is we can get moms the same exact results. And even now research has backed that up and shown that there's no difference in outcomes. So it's truly just your choice. Like, do you want to go in person or do you want to do it online? You're going to get better either way. Now you get to have the empowered choice and not let there be like multiple excuses or reasons why we can't prioritize ourselves.
Yeah, I love that. Love that. So if someone does want to work with you, how can they find you? Instagram, website, podcast, all the things?
Yeah, absolutely. So they can go over to my Instagram. It's at your postpartum PT. Obviously, you can hit the link in bio, but if you're really serious and you're wanting to take the next step in your healing and recovery, you like the vibe of being in a holistic support system and working one-on-one with us, then just go ahead and DM us the word restore, RESTORE. And then that way we can just get into like an immediate chat and have a good conversation to see if we might be a good fit for you to support you.
Well, perfect. I will link all of that in the show notes. And thank you so much, Jessica, for being here again. I really enjoyed talking to you. And I'm such a big advocate for pelvic floor PT for anyone and everyone, not just VBAC. So I love that you are here and I love this conversation.
Yeah, me too. Thanks so much for having us, Hannah. And it really does take all of us to continue to spread the mission and keep, voicing and amplifying the need for this. So thank you for doing that and having me on.
You just finished another episode of Motherhood Flow. For more, head over to thehannahgill.com or on Instagram at thehannahgill. As a reminder, this podcast is provided to you for educational and entertainment purposes only. It should not be considered a substitute for medical advice. Until next time, keep flowing.